From Thursday the 5th of November, England will be in its second national lockdown of 2020. We've been told once again to stay at home in order to save lives. While working from home, writing and reading filled up some people's lockdown days, for others, struggling to survive from one day to the next was the new normal. The government released a report in September showing that mental health distress was higher in March this year than in previous years, with women and young adults most badly affected. The strain on health services across the country has been enormous.
So I started working in April. So I came out as what's called COVID support. So because the ambulance service was so overwhelmed, I came out to help with the kind of demands that was happening due to the coronavirus pandemic. So it was quite scary. It's the first time that I was out on an ambulance in that kind of way, and working independently as opposed to not with a student. And for a lot of people, people would come back from retirement. The fire brigade were out helping with us because there was such a high demand for ambulances. So it was a completely different thing for us. We were very, very busy. Our criteria for leaving people at home was very, very high. So a lot of very sick people were being left at home because the hospitals didn't have the capacity for people. So it was a really massive change for us, for everybody in all aspects, from the people who prep the ambulances, to the staff, to the people in offices, to the call handlers, to the A&E nurses and doctors that we took our patients to. It was a really massive change.
When asking Jessica about the rise in mental health concerns during the pandemic, she highlighted that a lack of resources and support was partly to blame.
In terms of kind of mental health, I think that was a massive thing we saw. I think there was something like a 50% increase in mental health related calls to 999 since February. And that is sheerly down to the coronavirus pandemic for multiple reasons. Firstly, the pandemic has a massive effect on people's mental health. Not being able to work, not being able to go to the gym, not being able to go and see your friends and family is incredibly isolating. Not having the ability to talk to those people face to face all the time is really difficult for people. In addition to this, mental health resources, things such as AA groups, support groups, face-to-face therapy sessions, anything like that, a lot of them were cancelled because of the risks, which is understandable from a kind of pandemic controlling point of view. But in terms of mental health, this really affected people because people couldn't access the normal resources that they would have. So people went from having face-to-face, counselling appointments twice a week, or, AA appointments, or whatever it may be, and they no longer had that. And, it was a massive change for a lot of people being able to access that kind of physical face-to-face counselling or help that really, really meant that people declined in their mental health.
So while we find ourselves at home over the coming month, it's important to look after our own mental health and check in with others.